For me, surgery is more intellectually violent. When you're in the heat of battle, you've got one goal, and so you have to direct people. Plastic surgery is not for everyone.
Dr. David Hidalgo is a world-renowned plastic surgeon, board certified by the American Board of Plastic Surgery since 1987. He was the chief of the Division of Plastic Surgery at Memorial Sloan Kettering for 10 years. He's also written over 100 scientific papers. He's currently the clinical professor of surgery at Cornell, and he's been in private practice here in New York City for over 20 years. He's an incredible visual artist, and he's one of the featured surgeons on the Feel Confident Beauty Experts section. So I got this quote from your Instagram, and it was really cool, so I just wanted to read it and get your response to it. So, drawing exercises the way I see form, proportions, and shadow. The rendering process connects the brain and the hand in pursuit of aesthetic ideals. Both elements regularly practiced make me a better plastic surgeon too. So with your artistic background, and I just wanted to get your thoughts on, like, do you think that for someone to be a great plastic surgeon, they need to have that artistic ability as well?
I think it's a distinguishing characteristic. I have many great colleagues who are superb surgeons who probably can't draw a straight line, but I do think it's an advantage. Everything we do is about how we see. And whether it's a drawing or whether it's a form on the body, it's all about shadows and lines. So art helps a lot.
And I wanted to find out, like, what art pieces you're working on now. I know you recently posted about one of your works, but do you have any that you're currently working on?
Yes. Well, Gary, I've sort of evolved over the years. I started out as a painter, but I just couldn't get the results that I wanted. And it's like when we shape our specialty in our practice, there are things we like to do and things we're maybe not as good at. So I gradually evolved to drawing, and specifically charcoal drawing. And what I like about it is you can render images very large. And with graphite pencil, I used to do that, but I couldn't get the images very large because the blacks weren't as black as you needed to be. It was more of a sheen to it. So I've gravitated towards large charcoal drawings.
And how much time do you have to dedicate to that? Because you have a busy practice.
Yeah, I mean, it's something that it's like building a house. You work on it a little bit each day. It doesn't look like you did much, but a year later, you got something that's finished and something that's great to look at. And all my work is extremely detailed, and I just focus on that. I used to do microsurgery, so it kind of is like that. And the good thing about drawing is it's not like other endeavors. I mean, we're not getting paid for it. It doesn't matter how long it takes. I just want to make something that's perfect in my eye.
And once it's complete, where does it usually go? Is it just in your house, or do you give it to friends? Or
right now I'm just stockpiling them, and hopefully someday I'll have a show. I only have 12 of those large images so far. I can only do 1 or 2 a year.
It made me think that, like, since it takes so long for these pictures and paintings and drawings to come together, like a whole year, in a way, it reminded me of like surgical healing. And many of our patients, they get surgery and they think that, a week later, that's going to be their final result. But we know that it takes time to heal. I do a lot of hair surgery. It's like the hair doesn't come in right away. But even with surgeries where there's like a more instant result, like the nose, okay, was adjusted, but still going to be swollen for a while. So do you ever see it, like some similarities between those, like the surgical recovery and waiting and being patient for that, and then like the patience you need to do your art?
Well, patience, art for me is a form of meditation, so it's different. And unlike surgery and what you've just described, you are making the finished product at each step. Particularly with the photorealism drawings that I do, I work left to right, and as I'm going across, it's finished. But I guess like surgery, you don't see the whole thing until it's done, and that's like 6 months to a year later.
Yeah. I mean, I do think of surgery as sometimes being like meditative. At least, I don't know, for me, like when I'm in it, like you're so just honed in to what you're doing. And I've tried like actual meditation, and I feel like it doesn't work as well for me. So I don't know if you ever feel that way when you're working surgically.
Surgery for me is, there's some types of surgery like hand surgery. It's very methodical. It's pleasurable to do. For me, surgery is more intellectually violent. because I'm looking at things that aren't right. I've got to make it right. The clock's running. It's got to be perfect. Patients trust us. They lay on our table, and so that for me is the hardest test. So it's not meditation. It's actually it's a lot of effort, brute force sometimes.
How do you deal with the stressors of surgery? I mean, there's stress with life in general, running a practice. There's lots of things I'm sure we could get into, but specifically the stress of of an upcoming surgery, or like while you're operating and something's maybe not going well. How what helps you kind of cope with that?
Yeah, I never have anticipatory stress. I know a case I'm going to do. I've been doing it long enough that I know I have the experience that whatever's going to happen, I'm going to figure it out. And similarly, when you get yourself in a hole, you have to work your way out of it. And it is very stressful. And you're the one feeling it. The nurses, the others, anesthesiologists in the room, they don't really feel it. So it's a very intense experience. Um, so.
Yeah, yeah, for sure. Is there any sort of state of mind or anything that you can get into when you're feeling that to make it a little bit easier on yourself, or you just kind of like you said earlier, brute force, just go through it?
You have to push through it. And again, it's not like you have a nagging thought, how am I going to figure this out? You're going to figure it out, but it's step by step. You do things not right, undo it, do it again, not right, undo it, do it again. So it's a process that you have to work through, but you do have the other stressors. When you have an office, there are other things going on. There's time pressure and things like that. But you have to focus on what you're doing. That's the most critical thing.
Yeah, I think because like we are at the end of the day the ones truly responsible for the patient, and we feel that stress. Sometimes I feel like, well, every time everyone else in the room, they sort of look to us to kind of guide the ship, and I find myself sometimes, especially when it's really like a difficult case or a difficult moment, um, not like necessarily getting more rude, but getting a little bit short with people and just like almost like bossing people around. But and then afterwards, I kind of feel bad, and I know that people who work with me regularly, they're receptive to that. They understand that there's no hard feelings, that we're just trying to achieve a nice result. But I've definitely worked with people where they don't understand that that's why it's happening. Because I think there's this misconception sometimes that, I don't know, like surgeons are these like, really difficult to get along with people who are just bossing everyone around in the operating room, or being mean to people. But I think some of it can stem from stress, and I think if it's got to be interpreted the right way. And of course, people can go too far with things they say or things they do. There's a point there. You can't just cross the line, but I do find that it brings that out in me, whether I like it or not. But it's because like it's usually a necessary thing to kind of line everyone up to make sure that I have the tools I need. That if we're missing something, that someone is getting it because I need it. So I don't know if you feel yourself changing as you're operating.
I think a good analogy is it's kind of like the military, and we have a platoon of soldiers, if you will. And when you're in the heat of battle, you've got one goal. And so you have to direct people. And you're not always going to be pleasant and nice. You're not going to be rude and yell, of course, but you're going to be interpreted as short. But then the people who work with you understand that. And they say, okay, this is an urgent moment. We have to perform. And then when the surgery's over, you're more collegial, and that goes away. But I think it's a hyper focus that you need in moments like you're describing. And you can't be a nice guy about it sometimes. You have to focus on the objective and get it done and mobilize your staff so that you can achieve the goal.
Moving on to academic practice versus private practice. I know you've had lots of experience in both arenas. Can you describe some of the pros and cons of each for you?
What I liked about plastic surgery is that it runs the gamut from reconstruction to cosmetic surgery. And where I trained at NYU, we had superstars in every category. So as I went through my training, I said, wow, you can be great at reconstruction and you can be great at cosmetic surgery. So my goal was to be good at everything. But when you start a practice in plastic surgery, it makes sense to start at an institution where it's academic based. You get more patients right away. You get more interesting problems from the get go. You're not, sitting in your office with your shoes up waiting for the phone to ring. So I really enjoyed that. I did that for 14 years at Memorial Sloan Kettering. And um, I went there as a microsurgeon, and the head and neck surgeons there, for example, they needed someone who could do that, and they didn't have someone. And so, we would take the face apart, rebuild it with microsurgery. We did some great innovative things. And it was one of the most productive parts of my career to be in that environment. And I truly enjoyed it. But I think as time goes on, as we go through our practices, things get routine, and you want to do other things. And plastic surgery offers you the opportunity to morph into a different type of surgeon if you wish. I was always attracted to cosmetic surgery, and I did it even while I was at Memorial doing reconstruction. But I subsequently transitioned to it, and it was right for me to do something more institution based early on, get the wealth of experience, do the interesting work that changed the field, and then to transition to aesthetic surgery, which by no means is any less challenging, as you know. It's a game of millimeters in both arenas. So I feel very lucky that I've been able to do both.
How did you find that transition at the time that you did it? Because I think it was like 20 years ago for the
Yes.
transition to private. How was that for you? Was it pretty seamless because people already knew you from the academic realm, or was it difficult still at first? And then also all the other things you had to do to run a private practice. Like, how did you
Yeah,
find that?
it was. It's something that I had from the day I went to Sloan Kettering. I had my mind set that eventually I'd be an aesthetic surgeon. So it was what was the journey going to be like? How was I going to get there? I thought I could do it in 5 years, and it took me 14. And it was a type of thing where it's like you're stepping on the gas, then you're doing the other one. You're sort of modulating, and gradually more aesthetic surgery and less reconstruction. But you're getting pulled in both directions. So as you've decided in your practice, you want to shape it. And so gradually I started cutting back on some of the most arduous type of reconstructions, the microsurgery, 12, 15-hour surgeries, in favor of more aesthetic surgery, whether it was breast reductions or facelifts or whatever.
And do you ever miss some of those more intense microvascular cases?
Well, to use the military analogy again, if you're a soldier, you want to go into war and you want to have a great experience, and that's what Sloan Kettering was for me. It was like super intense, and by the time I got done with it, I didn't want to go back. It was wonderful. I enjoyed it. I got everything out of it that I wanted to, but it was enough.
What do you find to be some of the most challenging aspects of running a private practice?
Well, I think the part that we don't like as physicians is the part that we were never trained for, which is the business part of it. We're wearing many hats during the course of a day. We're HR departments. We're doctors. There's so many different roles that overlap. We're business people. So it's very challenging to keep shifting hats, and some things personally you don't like as much. Like I don't like running a business as much as I like operating and taking care of patients. And I wish there was someone who would do that part for me. But as you know, it's part of running a practice.
And what is the current mix of surgery types that you're focused on these days?
Well, Gary, it's like when I was at Sloan Kettering, the things that got to be too much in terms of labor, I cut out. And similarly, with aesthetic surgery, I started trimming some things that I had I had done more than my share, and I just found them to be more labor intensive for the reward that it gave me psychically. So things like breast reductions, I finally stopped doing them. And secondary rhinoplasty, which is, as you know, exceedingly challenging. And patients expect 100% result after they've had a bad first experience. Things like that, I've kind of, it just takes so much out of you that I've sort of trimmed back on those, and I've leaned more into breast surgery and facial surgery. That said, as you get more experience, you get the harder cases and the things that need to be revised that were not done well elsewhere. So I have a very big practice with revision breast surgery, which is very challenging, and I still enjoy that.
And what would you say currently is like the hardest part of your job? Because you've sort of seen it all, so much experience in every different facet. But what do you still find to be some of the most challenging? And it doesn't have to be with the actual surgeries. It could just be part of the, just managing the practice or anything else.
Well, it's interesting because today I'm still the first one in the office and the last one to leave. So for me, it's being ready for a 12-hour day pretty much every day. Friday's a little shorter, but it's having the energy to perform well in every sphere of practice, whether it's a staff issue, whether it's a surgical complication, whatever it is. You have to be at the top of your game. So I would say that's the biggest challenge.
Right. Interesting. So there are some people, especially, I get to see lots of feedback, especially on my YouTube channel, lots of comments, some that you don't really want to see, but they're there. But there are some people who just have complete distaste for cosmetic plastic surgery. They just feel like it's unnecessary. No one needs it. If you're not getting it done because if there's like a functional problem, then you shouldn't have it at all. I guess like what are your thoughts on that, and what would be your response to someone saying that?
I don't think it's our job to be judgmental. I think the body is our biggest asset. As we go through life, how we present to others is important. And some feel differently. They feel that this is what God gave them and they don't want to change it. And there's nothing wrong with that. First and foremost, plastic surgery is not for everyone. It's for those, and I find that most patients come with a specific issue that just bothers them. And whether it's the breast reduction patient or a rhinoplasty patient, and you fix that, and that's it. They're done with plastic surgery. Or, the older patients who don't like the changes they see in the mirror. When you're young, nobody even thinks of it. But as you get older, you feel the same mentally. You don't feel any different. But you look in the mirror and say, who's that? So, many of our patients, they just want to look on the outside the way they feel on the inside. They just want to go through life feeling as they feel mentally. So that's why, again, it's not for everyone.
Do you feel like the satisfaction levels are different between the people who are getting like a cancer reconstruction versus someone who has a little bump on their nose and they're getting it removed? Or do you find that it's similar, or it just depends on the person?
I think it's different, but it can be equally intense for both the reconstructive patient and the cosmetic patient. I think as surgeons, we feel more gratitude when we have someone with a terrible, threatening problem and we solve it for them. That's very gratifying, and the patients are deeply thankful forever. But similarly, if somebody's got something that bugs them and you change it, it's and again, the precision is sometimes even greater, because if it's not perfect within a millimeter, they're not going to be happy. So I think aesthetic surgery is much more challenging than reconstructive surgery. You can get a 90% result in reconstruction. Everybody's thrilled. And if you don't get 100% in aesthetic surgery, you've done a bad job. So it's different, but I think they're equally gratifying, equally important.
And what about just the future of plastic surgery? Like, do you think that there will be some great advances in the next, 5, 10 years with, I don't know, whether it's stem cells or, I don't know, anything else that you can think of that will sort of change the game for different procedures or anything else?
I do think important things are going to happen at the molecular level and even smaller. For example, there are already breast implants that are not approved in this country where the surface has been engineered in such a way that it doesn't create a fibroblast response, and the patients don't get capsules, which is one of the biggest problems in breast implant surgery. So I do think things are going to continue to evolve, and our tools are going to get better. And as we understand the genetic and molecular pathways of cause and effect of scars and things like that, I think a lot's going to happen. In scar management, I think, in the future, the scars will not be an issue like they are today because we'll find a way to control healing. So I think implants, scar tissue, and pretty much every other aspect of plastic surgery is going to advance significantly. I wouldn't say we're in the dark ages because the human body's been around for eons and it changes. It doesn't change. We're always working with the same thing, but our progress is in many small steps. But I think that will continue.
And can robots replace us, do you think? Especially going back to where we started on the artistic side of
Well,
things.
I think it's kind of like driverless cars. I mean, do you want to have that much trust in something that's going to happen? I don't think so. I don't think, or planes that fly themselves. I don't think anybody's going to want to get on a plane that doesn't have a pilot. I don't think anybody wants to lay on an OR table where there's no surgeon. So I think robotic tools like the Da Vinci system, that enables surgeons who are controlling them to do things through little tiny openings that they couldn't do before without making a big incision. So I think in that sense, robotics will continue to advance and be important to us, but I don't think it will ever take the place of a human physician.
And I guess this is going off topic here, but it seemed like during COVID time, people were on their Zoom and all that, and they were paying more attention to how they looked, and there was definitely a boom in our industry. Do you see that? I mean, it feels to me like it has slowed down, and maybe that's the greater economy, not just in this country, but just globally. But it does seem like there's maybe less interest than there was just a few years ago. Do you see that pendulum swinging back towards more interest, or was that just like a little peak?
I think it was a peak for sure because people saw themselves on Zoom like they've never seen themselves before, and even some of my patients when you have an iPad and you look down, but you can see your reflection and it makes your neck look like, oh my God, I better get this fixed immediately. So there's still an influence, but not as much as it was 3 years ago, 4 years ago during the pandemic.
And then I guess just for you, I mean, where do you see yourself in the next 5 years? Do you want to keep operating? Do you want to spend more time with, the art that you do, or more on like I don't know, some other academics level, like managing things, or are you just happy kind of with what you're doing today?
Well, what I would say is what I find stimulating is hanging out with young people, more so than people my own age. Their energy and enthusiasm and willing to learn. I like young surgeons, so I have a mentor group where we have 14 young plastic surgeons where we meet periodically and present on different topics. So I really like being engaged with the younger community. For me, it's always a tug of war between surgery and drawing, plus the things we do with our families and everything else. So I would like to sort of get more drawing, less surgery. But while you're still good at it, it's hard to put it down. And while patients still come and like I was saying earlier, they bring me difficult problems that not many can solve, and you can still do that. It's hard to let go of that. So I'm just going to play it by ear, see how it goes.
That's exciting.
Yeah.
Thank you so much, Dr. Hidalgo, for
My
joining
pleasure.
me. It's great seeing you. Welcome to the space
Thank
of
you.
ours, and thanks again. And anything else you want to add, or are we good?
I think we covered quite a bit of topics tonight.
Yeah,
It
for sure.
It was wonderful, a lot of fun.
Yes, thank you
Thank
so
you,
much.
Gary.
Thank you.
It was great.